Hello and welcome to the Donor Research Network Virtual Week of Talks. My name is Kelly Holloway. I am a social scientist with the Center for Innovation at Canadian Blood Services. I will begin my talk with a land acknowledgement. I am in Toronto, which is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse nations, Inuit and Métis people. My talk today is on donor experiences of a new source plasma collection site in Canada. It's a qualitative study, which I'm calling the social and plasma donor motivation. The background to my study is that the use of the plasma protein product immune globulin has expanded significantly in recent years, and many jurisdictions are finding it difficult to meet the demand for source plasma with voluntary non-remunerated donors. Canada only collects about 13% of what we need to meet the demand for source plasma, and we are increasingly dependent on the United States to collect plasma, mainly in private for-profit facilities that pay donors. Because of the rising need for plasma, blood collection agencies are developing strategies to increase local plasma collection and thus increase self-sufficiency. For instance, in Australia's Lifeblood, they initiated source plasma collection sites in smaller communities to build support for increasing sufficiency of plasma in the country. So Canadian Blood Services has learned from our partners in Australia as well as other jurisdictions, and with the support of the Canadian government has initiated a plan to increase Canada's domestic plasma sufficiency. This program involves 3 new proof-of-concept source plasma collection sites and seeks to demonstrate a workable, cost-effective, and successful template for future source plasma collection in Canada. This has taken place during the COVID pandemic, which has posed challenges, but also made the case for the need for source plasma sufficiency, as U.S. manufacturers have announced shortages in plasma because of the pandemic, and there have been newly imposed limitations to transport of products across borders. Our first 3 source plasma collection sites are in smaller towns in different parts of Canada, so Sudbury, Ontario, Lethbridge, Alberta, and Kelowna, British Columbia. Recently, Canadian Blood Services has announced that we will be opening 8 more source plasma collection sites across the country. So this study focuses on our first source plasma collection site in Sudbury, Ontario. Sudbury is located in northeastern Ontario and is a mix of urban, suburban, and rural, with a population of about 166,000 people. So Canadian Blood Services closed our long-standing whole blood collection site in Sudbury and opened the Plasma Center in August of 2020. The scholarly literature on plasma donors primarily takes a behavioral sciences approach, measuring motivations and deterrence of donors in a voluntary, non-remunerated context, finding that they are motivated by an interest in helping others, and further, they're motivated by an appreciation of the fact that the blood operator needs plasma. And the literature on the role of the blood operator in plasma collection indicates that the blood operator plays a role in motivating donors to convert from blood to plasma, and that the main trigger for conversion to plasma is a personal request by collection staff. There's also been some theorizing about donation as a social act. For instance, Charbonneau makes the case that blood donation is a fundamentally social act linked to diverse personal, political, and cultural meanings, as well as to the population's trust of the state. And this approach emphasizes how actions and activities unfold over time and in a context. The sociology of donation means recognizing that donation takes place within broader social contexts. And research using this approach shows that plasma donors are motivated by wanting to help others, feeling good about donating and being a good citizen. Regular plasma donors work to fit donation into their lives, and meanings donors associate with donating plasma sustained their behavior. For instance, connecting donation to contributing to the plasma supply and helping others. And that work is from Rachel Thorpe at Lifeblood in Australia. There is also some literature on payment for plasma donation. For some, the demand justifies the need for remuneration. The demand for source plasma justifies remuneration of donors. For others, payment could result in harm to the donor or represents the commodification of the human body, or that it will undermine the altruistic motivations of donors and thus undermine the blood system. There's very little empirical work on donors and payment for plasma or on the emerging commercial sector for plasma in Canada, so this is one thing I'm pursuing in my study. My methodology is an ethnographic process evaluation. So I have been immersed in meetings of the plasma division since January 2020, in person and online. The study is iterative and collaborative, so it uses ethnographic methods that allow me to be immersed in the project and develop insights based on ongoing participation. So a process evaluation measures the success or failure of a program, taking in the needs, wants, and concerns of the potential users. And defined that way, it incorporates individuals responsible for devising and implementing the project and the users that will be affected by it. My methods are to interview key informants associated with the plasma division, participant observation and meetings of the proof of concept operations team, document analysis, and semi-structured interviews with donors, staff, and volunteers. To date, I will be presenting on 33 semi-structured qualitative interviews with donors in Sudbury, conducted between December 2020 and February 2021. Sudbury donors were asked about why they donate, what they like and dislike about the center and donating, promotion of plasma, and their thoughts about the political context of plasma. Interviews were transcribed by a professional transcriber, entered into in vivo a qualitative software and coded line by line, and then interview data was analyzed using grounded theory and abductive analysis. This is the demographic information of the participants of the study. So as you can see, the gender was pretty split with a few more female. In terms of age, there was a range, and most of the donors had some university education. Most of the donors were white, with several other ethnicities represented. And 28 of the 33 participants were whole blood donors that converted to plasma. Most participants found out about the plasma center in the blood center when staff told them about the transition and asked them to consider donating plasma. When asked about why they donate plasma, the majority of donors said it was because it helps someone who needs it. Some specifically said that their reason for donating plasma was that they wanted to continue to donate, and plasma was the only option. So one person said, I'm a whatever donor. I'll donate whatever you want. Other reasons included giving back. It could be me or my family that needs it one day, and it's easy. Most donors didn't connect the reason for donating to the uses of source plasma, but they were aware that there is an increasing need for source plasma in Canada. There were 5 new donors in the sample, so people who hadn't previously donated before, and they were more likely to say their reason for donating was connected to the uses of source plasma. I interviewed donors about 4 months after the center opened in Sudbury, and most of the participants had donated more than once. One had already gone 25 times. When asked about what keeps them coming back, the most common answers from participants were 1, that they enjoy the people and the atmosphere in the center, and 2, that there is a need. Most talked about the needs generally as carrying over from whole blood. For instance, someone said, well, just the same reason I gave whole blood. I know it's needed and it's something that is relatively easy that I can contribute to, so I do. The safety of the center was also important in retention. All of the participants felt safe in the center because of the safety measures that were put in place during COVID. That included masks, physical distancing, taking temperature, cleaning everything after use, hand sanitizer, easy access to hand washing, plexiglass at the entrance, and screening questions. Most participants said COVID had no effect on their interest in donating plasma, but 2 said it made them want to go more because there was a need and because it was an excuse to get out of the house. So one participant said, especially with COVID, you don't have to go out and be around people and worried about exposure, but you still know that you're doing something. You're helping a community of individuals. This community feeling was an important theme in the interviews. most participants felt that there was a sense of community in the center, and this was connected to the earlier finding about retention, and that participants enjoyed their time in the center. Reasons that they gave, the most primary reason was that staff in the center get along with each other. There was a dynamic between the staff that the participants really enjoyed because the staff seemed to like each other and interact with each other well. Participants liked interactions with staff and volunteers. So they talked to staff, they liked having conversations with the staff and having that kind of personal interaction. They enjoyed talking with other donors. They said the facility promotes the community. It was a new facility, so they liked the way that it was laid out and said that it promoted the ability to get to know each other and the staff. And then they talked at length about the food in the center. The food that we're offering in the source plasma collection sites is different from whole blood. Participants get a menu while they're donating, and they get to check off what they want. They have some options including a charcuterie board and local pastries and a number of other things, and participants went on and on about how wonderful the food was, but also that they appreciated that a lot of the food was provided by local vendors, so businesses in their community. And they said that that was particularly important during COVID, when a lot of local businesses were being hit by the inability for people to go out into the community and spend their money. So they appreciated that Canadian Blood Services was working with local vendors to support them. A few participants said that they do not get a strong sense of community yet in the center. Some said that was because they thought the staff were having a difficult time with the transition. There were layoffs at the Whole Blood Center, and then some staff were rehired in the Plasma Center. And then some said that they were just used to the community that they had developed in Whole Blood, and that hadn't quite developed yet in the Plasma Center. When I asked about what they did during the donation, almost half of the participants said they talked to staff. Sometimes it was just chatting, but also many were really interested in the equipment and talked to staff about how everything works. Most participants also said they look at their phone or watch TV, but when they elaborated, they said that this is me time. It's a time to relax and do nothing. And sometimes this was also about having someone take care of them. So one participant said, "What happens in my week, what kind of crap I face, it's nice to have the combination of coming in and knowing people are going to be very kind and welcoming, and people seem to really like what they're doing." Participants also really liked that the staff was professional and knowledgeable about plasma, and that actually helped them put them at ease. So a participant said that the staff explained to me exactly how the machine works and what they were going to do step by step. So that really put me at ease. And she even started like a side conversation about, she had just moved to a different town, in a town I'm very familiar with. So we got to chatting, and that really settled me down. Almost every participant tells people about their experience donating plasma, and most encourage others to donate. Participants mainly encourage people they know in person, such as a spouse, immediate friends, and family. Some communicate electronically over social media or text or email. COVID was a barrier to their ability to do this. So some donors really didn't like posting on social media about their donation because they felt like it could be seen as bragging. They had previously relied on visual cues, so they had gone to donate blood and went to a coffee shop with a Band-Aid on their arm and would rely on someone to ask them, what that was from. And they weren't able to do that during COVID because they weren't out in the community. Another important finding is that when participants encourage people to donate, they use messages like, "It's easy, it's a way to make a difference, it can have an impact, someday you might need it, it saves lives." So in terms of how participants encourage others to donate plasma, two things I think are important to note. First, that in this small community, word of mouth seems to be an important source of promotion for this new plasma center. Participants talk to their friends and family about donation and actively encourage people to donate. Second, when they encourage others, their message aren't very specific to source plasma and its uses. They give generic reasons for donating, and those most likely come from their knowledge of whole blood. Some participants actually noted the need for more education about plasma and what it is and what it does. When asked how Canadian Blood Services can better promote the center, participants said first demystify the experience. So they noticed that their friends, colleagues, family were just felt like there was some mystery about what happens in the center because it is different from whole blood. So they said, talk about what it's like in the center, what it's like, the physical feeling, what that's like, the time commitment, the eligibility requirements. The second thing was that they think Canadian Blood Services could do more community outreach. So in schools, at community events, word of mouth, local food, places of worship, going into workplaces. And obviously that was difficult during the pandemic. And then finally, to emphasize the need. So they wanted stories from the recipients of source plasma. They wanted to understand how plasma has an impact in the lives of fellow Canadians. And they wanted stories from donors like themselves and how those people had moved over to plasma and how they were finding it. Participants were aware that there was a greater need for plasma in Canada. They thought it was important to gain sufficiency of source plasma in Canada so that we don't have to rely on the United States. At the same time, many were not aware of the uses of plasma, what happens to their donation, or how plasma is turned into treatments. But interestingly, most wanted to know more about all of those things. And several participants said they wanted to know more so that they can do a better job of encouraging friends and family to donate plasma. When asked about their interest in knowing more, there were several participants who said they want to know so that they can talk to their friends and answer their questions. With the aim of putting the donation experience into a social and political context, I asked donors how they felt about first, payment for plasma donation, and second, the emergence of private for-profit centers that pay donors. There is no for-profit plasma collection center in Sudbury, and in fact, there's legislation prohibiting payment in the province of Ontario. Nevertheless, payment and for-profit collection sites exist in Canada, and the Ontario government could change the legislation that just took place in another province in Canada, Alberta, about a year ago. Some participants said that they don't want to get paid for donation, and they noted that the snacks are enough, or it's just not something they're interested in. They just said it's not for me. About half of the participants said Canadian Blood Services should not pay donors, so they were opposed to it. This was connected to the identity of helping people that was a part of being Canadian. So one person said, I think in Canada, we have a certain ethic around volunteering and giving, and that might undermine the reasoning behind people giving in the first place. They also said they wanted to protect the safety of blood. Donors could put their health in jeopardy if they're motivated by money, and payment could change the community aspect of the center, and that they did not want donation to become a commodity. About a third of participants, including 3 of the above, said they would be open to Canadian Blood Services paying donors if Canada is short on supply of source plasma, and it becomes necessary to pay donors to meet sufficiency. Many of these participants also just had questions about Canadian Blood Services paying donors. Would it still be safe? So people who are marginalized and destitute could bring in complications to the blood supply. People could lie on the questionnaire. If people are motivated by money, do they have the same forgiving approach to Canadian Blood Services when they're turned away or have complications? One person said, I went on social media to advocate and you could have the opposite. Another question was, would people have to start paying to receive plasma? Is this an infringement of private interest in the Canadian healthcare system? And is this a good business decision for Canadian Blood Services? Only 3 of the 33 donors that I spoke to had heard of for-profit plasma collection centers in Canada. more than half of the participants were opposed to for-profit collection centres, and the primary reason was that it undermines Canada's public healthcare system. Plasma donation is meant to help people. Other reasons are that plasma donation is meant to help people, so payment shouldn't come into it, or that it could mean fewer donors for Canadian Blood Services. One participant supported for-profit centres as long as the standards are just as high as Canadian Blood Services or higher. And then 5 participants were ambivalent or said things like they would stick with Canadian Blood Services if there was a choice, but they're okay with it if it helps with increasing sufficiency. But many of these participants also had questions about for-profit collection sites because they weren't aware of them before. So they wondered, is the blood safe? What are the consequences to the voluntary blood donor base? Why do for-profit collection sites exist? Where do for-profit collection sites sell their plasma? Are for-profit collection sites following the same regulations as not-for-profit? Where are the profits going, and what do they use the profits for? So in my discussion, I'll just say the study confirms findings from the scholarly literature that the primary motivation for plasma donors is to help others, and that an additional motivator that distinguishes plasma donors from whole blood donors is the appreciation of the fact that blood donors, that the blood operator needs plasma. The blood operator plays a significant role in motivating donors to convert to plasma, and staff have a significant role in this request. The study also adds to the scholarly literature on donation as a social act, so in that there was a sense of community in the center that was important for retention, and that staff were central in creating a welcoming donor experience, and that their knowledge of plasma put the donor at ease. In fact, knowledge was an important theme in this study. Knowledge was important in community outreach, and that participants wanted more information about plasma, its uses, and its impact so they could better advocate for plasma in the community. Participants wanted Canadian Blood Services to encourage more donation through stories from recipients, support local supply of plasma, and stories from donors. And finally, the study adds important empirical work about how donors feel about payment for plasma and for-profit plasma collection. So the next steps in my process evaluation are to do a similar round of interviews with source plasma donors in our other 2 proof of concept source plasma collection sites in Lethbridge and Kelowna, and then compare the donor responses across contexts. And I'm also doing ethnographic work in the source plasma collection sites in Sudbury, Lethbridge, and Kelowna. And thank you for listening to my presentation. I would be delighted to receive emails with questions or feedback. Enjoy the rest of the DoRN Virtual Week of Talks from my excellent colleagues in this field.